Hi guys, Grace here. I just want to touch on a few things that I posted about today. We've definitely stirred up some conversation which is great. We're going to talk about new patient numbers, how to identify your ideal new patient number goal, and why it's okay if your number is vastly different from someone else's number. But I'll tell you why there's no wrong answer, and I'll tell you why you should have an answer, you should have a number, and how that helps you in planning your marketing. And I'll be quick, I promise. Then I'm also going to answer the logo question. How frequently should you change your logo? It's a little bit of a trick question. So the first question, new patient numbers. This question should be determined based on what you can handle and still provide quality care. So for the people who say the sky's the limit, obviously they have a focus on expansion and they're passionate about business expansion. And if they run out of rooms or times, they're going to create rooms or times that they could see patients. They're going to recruit providers, and they're always going to be growing. And they're going to be timing their growth appropriately for their expansion so that they have no limit. But even at that point, at any given moment, you have a capacity. Everybody has a capacity of what they can handle before they drop the ball. And you don't want to drop the ball when you're providing oral health care. It's very important, obviously. So you look at your capacity, you look at what are you comfortable in terms of treating. You look at a new patient, value of new patient. How many can you handle based on a lot of things, retention, insurance participation, how hard you want to work, how many dentists you have available, hygienists you have available, and you come up with that number that's comfortable growth for you. And then you look at what are we doing to bring in, let's say we have 15 and we want to be seeing 25. What are we doing to bring in the 15, and what are our next best options to get to the 25? So that's a conversation I have a lot of times with people during a marketing planning session. And so it's helpful to know your number may not be the same as someone else's, and it doesn't make your number right or wrong. It's very unique to your business and what you need and the pace at which you want to grow. I would say an average, if I'm just throwing out an average number, it's usually 25 new patients per full-time provider. So again, that could be very different for different practices, different models. How much time do you spend with a new patient? How much time do you have for new patients? There are a lot of variables that play into this. Okay, now on to the logo question. How often should you update your logo? I got a really good chuckle out of this because I saw a lot of answers that were, my logo is timeless and it never needs to be changed. It's iconic, and yes and no. So yes, you want a logo that can last. You want a logo that isn't so super trendy that you have to change it in a year from now or 2 years from now. But you also want a logo that does appear modern. And no matter how much we think we're outside of trends, we're never outside of trends. So even if your car is 10 years old, even if to you love it as much as you did the day you bought it, it looks 10 years old to everyone else. And in dentistry, we don't want to be perceived as outdated or old because your consumer makes this assumption about your brand that if your logo is outdated and old, if your fonts are outdated and old, that your technology and your level of care is outdated and old. And in dentistry, we just don't want to be put in that bucket. We want to have a modern brand. Therefore, you should be updating your website or your logo and branding, and also your website. And since that slipped out, I'll talk about that too. But your logo should be updated every 5 to 7 years. This doesn't mean that you become unrecognizable or you completely rip it apart. It just means that you're assessing design trends and you're evaluating if this is something you need to update in order to still have a modern appearance. I love looking at logos. I love giving people honest feedback about what they can change to stay modern and to have that up-to-date appearance so that they're attracting patients who value quality and who value modern care. So if you want those patients that value modern care and want the best, then you've got to present as modern and the best. So, and it starts with your logo. So yes, there's a lot of psychology that goes into a brand. I do a whole bunch of training on this. I have courses around this. But the short of it is every so often you need to evaluate your brand. Another time you want to update your brand, even if it's 2 years after you developed your logo, but now you need to update it, is if things change. So let's say when you first developed your logo, you wanted to be known as the high-tech, best, solution, and you're super techy. And as time has gone on, you now have an associate in that practice, and they're treating kids, and they're super gentle, and they're warm, and they're really submerged in the community. You may need to tweak the look and feel of your brand to give off the right impression. So when our print collateral, our digital collateral, our branding, when our marketing things match who we truly are on the inside, then we're going to attract the right kinds of patients for us, because they're picking us and we're presenting ourselves in a way that's true to who we are. So yes, you need to update your logos. No, they're not timeless. Yes, you need to consider trends, just like your wardrobe, your interior design, or your car all experience design trends. Logos also experience design trends. And if I had to put a number on it, again, I'd say 5 to 7 years. Definitely every 7 years is a good time to look at it. And even if you look at Nike, look at Pepsi, Coca-Cola, you can look at big brands. They do evolve. Right now we're in this trend where everything's getting more and more simplified. So if you look at like the Starbucks logo, from the time that the business was founded until now, you'll see that it got cleaner and simpler and simpler and simpler. But that's going to change too, and there's going to be different design trends that filter in from there. So it's an evolution. You don't need to throw it all away and burn it down, but just little tweaks. So anyways, I hope this information is helpful to you. And if you want me to take a look at your brand, if you want me to take a look at your website, let me know. I'm happy to give you an honest opinion on where you stand and what could be better. So thank you guys so much. I hope you have a great day.